Hi there, it's time for Tori Talk. I'm guessing if you clicked on this video that you probably have mandibular tori, and if you're anything like me, you are quite curious about how it is to get them removed and maybe listen to somebody else's experience. So hopefully I can share my experience with you. So my mandibular tori first came on the scene that I recall when I was about 23. And a friend of mine, I don't know how it happened, just looked in my mouth and said, "What are those white bumps in there?" And I didn't know what she was talking about. But when I looked in the mirror, what I saw didn't really match up with what I was feeling with my tongue. But obviously, I had mandibular tori. Fast forward many years, they continued to grow and weren't really causing a problem. And in doing some research, I'm sure like you've done, it wasn't an emergency or anything like that, but over the years they'd grown quite large, and I've noticed in the last couple of years it started affecting my speech. I was some words I would pronounce just sounded like I had a Castilian Spanish accent or something. So I did a little investigation on how to have them removed. My dentist also helped me. My dentist remarked that my tori were becoming large, and he thought, eventually going to impair his ability to clean around my gums because the top of the tori were that tall. So I looked into having them removed. My dentist recommended a couple of oral surgeons, and I contacted them, two of which gave me some prices. One was about $1,500, and I think the other was closer to $2,000, and that may have been um, the price may have changed a little bit if I wanted to have a local or a general anesthesia. Well, I go to Mexico every winter to get out of the snow and cold of Utah. And while I was here this year, I decided to investigate possibly getting the mandibular tori surgery while I'm here. So I did a little research and I found a doctor that I trusted. She works in the public health care system here in Mexico, but she does have her own side practice. Apparently, that's quite common down here. So I had an initial consultation with her, which I think was $40 or $50. And she explained that she had done this procedure many times and does it several times per month, usually with older patients. And they must really be older because I'm 60, so how much older can you get? But she told me how the surgery would go, what I could expect, and she quoted me a price of 16,000 pesos, which at today's exchange rate, roughly 19 pesos to the dollar, is about in the neighborhood of $850. So I thought about it, and I am elected to do it, and I'm going to go do that surgery tomorrow. So it was pretty straightforward. She told me that she wanted me to have some testing. So she gave me a prescription for a bunch of tests. There's a laboratory service in Veracruz that I used that had sort of a package deal that offered everything that she required for 2,000 pesos, which is about $100, just a little over $100. So I had those tests done. She was really concerned about uh, what the levels were for my blood. Wanted to make sure that the hemoglobin was good. I imagine this is because she didn't want any bleeding difficulties or anything like that. But in addition to doing blood work, they gave me, they took my blood and they checked for several things, several levels. They did a urinalysis, we did a chest x-ray, and we did an EKG. So I sent all those results to her. She said that they looked fine and we could proceed with the surgery. So we scheduled it for the next weekend, which is tomorrow for me, and I'll let you know how it goes. So I guess I owe you a before and after shot of the tori. I did take a picture a while ago that I sent to the doctor, but this is what they look like today. Tomorrow will be a different story, let's hope. Well, it's the morning of my surgery and I'm a little bit early. Anyway, let's see how it goes.
Y ahorita que venga la doctora, pues ya puede hablar con él.
Okay.
Puede comer dietita líquida.
Ajá,
de
entonces...
la sopita esa de 10 minutos, que son estrellitas.
So this, ¿es el quirófano? Okay, bye bye.
Bye.
Okay, it's been about a half hour, I think, since I got out of the surgery. It went really well. I was in a little bit of a anesthetic fog. I was sleepy, but I think I remember most of it. But I can tell that the tori are gone, but my mouth is still asleep, so I can't really feel it. And I can feel that there are stitches in there, but I don't know. So this is what it looks like. They offered me the option of staying in the hospital for a night, and they told me that it was only going to cost about $75, and that included an ambulance ride over there. It's only 2 blocks away, but you know, the hotel was going to cost about that much, so why not? So we'll see you in the hospital. Well, this isn't my first time in an ambulance, but it's certainly my strangest time. Well, it's been about 2.5 hours since I got out of surgery. So the anesthesia is starting to wear off. The bottom of my mouth is kind of sore and tired. With my tongue, I can feel the stitches. I can also feel that the tori are gone. And finally, my tongue has a place to rest in the bottom of my mouth where it was supposed to be the whole time. So that feels good, but the gums are quite inflamed, especially up near the teeth. And yeah, I'll keep you posted. I don't know if I can get a good enough photo or not, but I'll try. I guess I need a flash. Well, hi, it's day 2 of recovery. Surgery day was Saturday, and recovery day 1 was Sunday, and here it is Monday. And I'm not feeling all that great, to be honest with you. I guess this tori surgery was a lot more than I anticipated. I was thinking this was going to be, you know, similar to maybe getting a tooth extracted, a dental procedure, and it was a lot more than that. Just not having any real food for a couple of days has caught up with me, and the food that I've had has been pureed and gelatin and then some ensures and kind of gross. So Actually, I've had some diarrhea, so that's been fun. I'm feeling kind of listless. There's not much pain in my mouth, but I can feel the stitches with my tongue, and I'll go into that in a little bit more too. So, not a lot of pain, some inflammation. I've been on a lot of drugs, but as you can tell, I'm talking okay. So, we'll catch up with you in a day or two. Well, it's day 4 of recovery, and I seem to feel back to my old chipper self. Not sure what was going on day 2 of recovery. I was feeling kind of lethargic, slightly nauseous. I'm not sure if it was the pureed diet, the antibiotics, or maybe just crashing off of the anesthesia, maybe a combination of everything. But I seem to be back to my normal self, and things are going along well. There's no pain, there's no bleeding, the inflammation is going down, there's still a little bit. And I was able to buy a small compact mirror so I could get inside a little and take some better pictures. The doctor's kind of doing some follow-up care via sending pictures and videos and phone call and stuff like that, so I don't have to travel the 2 hours back to Veracruz for the follow-up. So if you'll take a look here, you'll see things are pretty nice and pink. There's some white spots. That's the extra skin that was left over. Obviously the tori were removed and there was a lot of extra skin. I'm not sure if she was able to remove some of that, but I know there is some skin that looks sort of dead, for lack of a better word. And I'm sure that will slough away and the new skin will grow in its place. But anyway, she seems to think things are looking good, so we'll keep you posted. So here it is, day 7 or day 8 of recovery. It's Sunday. Surgery was a week ago yesterday, and I'm feeling pretty good. The inside of my mouth is healed up pretty well. There were some stitches, and I'd asked about getting those removed, and she said these were the dissolving kind of stitches, and so they should dissolve. I think she said a week, but so they those flaps of dead skin that were in my mouth sort of went away, and underneath one of them was one of the surgical knots from the suture, so that was kind of bugging me, and I was able to get a pair of nail clippers and clip that off. And then the other side of my mouth, there seems to be sort of a knot of stitches as well. I'm going to try and clip those off today because they're bugging me. So I also had mentioned in an earlier recording about some drugs that I was on, so I'll go over those quickly. Okay, the first thing she had was amoxicillin. This, of course, is an antibiotic which I had to take for 9 days. Next was Algatrin, which is a combination of paracetamol and ibuprofen for pain and inflammation. And I was to take this every 12 hours for 6 days, but in talking with her, she said it was, for pain as needed, so I didn't take that. I took that a few times. I took it every day for 3 days, and then I didn't take it anymore. Next was something called Dolac, which I was supposed to take for 3 days every 12 hours. I looked that up online, and it's a combination of, it's an anti-inflammatory and pain medicine commonly prescribed after surgeries. So I took that for 3 days. Next was omeprazole, and that was for any possible stomach upset, mostly due to the antibiotics. And finally, dexamethasone. And this was an injectable drug. So the following day when I saw the doctor, I asked her if she would give me the injection, and she says, well, this was for pain, and if I wasn't experiencing any pain, then it wasn't necessary. So I bought 3 doses and 3 syringes of that and didn't need it. So you'll see the costs for all of these medications shortly when we talk about the costs for my surgical adventure. Well, in about a half hour, it's going to be exactly 2 weeks since I came out of the operating room minus my mandibular tori. And I'm very happy about how the way things turned out. And yes, I would do it again. So let's go over quickly the costs. So the initial consultation I had with the doctor was 800 pesos if I paid cash, 1,000 if I paid credit card. So that comes out to about $43 US. There was the lab work that I had done, which was about 2,000 pesos, which is what, about $102, something like that. Now the surgery itself, I thought she quoted me 16,000 pesos, but the night before when I went to kind of finalize everything, I realized somewhere there was a communication miserror, and it was 16,500 pesos, or about $894. There was a little bit of a surprise the night before when I got the instructions for how to prep for the surgery. I was told I needed to bring a couple of items, and I couldn't find them at the pharmacy here. And they said, well, don't worry, you can just buy them at the receptionist before surgery. I think they knew all along that these items aren't available really to the general public. One was the anesthesia, the IV anesthesia that I had to pay for myself, and the other was a gallon of some sanitizing solution, which I think they used to sterilize the OR. So anyway, I had to buy these, and that was an additional 2,200 pesos, which ended up being about $119. And honestly, that should have been, I think, in the cost of the surgery up front, and rather than a surprise add-on. But, you know, hey, it's an adventure. And then there were some prescriptions that she gave me that I had to pick up at the pharmacy just to go along with my post-op. And those were 725 pesos, or about $39. So the subtotal was about 22,000 pesos, or about $1,150. I would say that's a savings. That's about 2/3 of what I think I could have got it for in the US. I think they quoted me like $1,500, but I think that $1,500 just included a local anesthetic. So anyway, I think it was a bargain here, and definitely worth it. And if I wanted to tack on a couple of additional costs for my surgery, there was the hospital stay that I elected to take, which the doctors told me they had a deal there and it was going to be about $75, but when it came time to settle up the bill, it was more than that. It was 2,115 pesos, or $115. And then because the town that I live in is a couple hours away, it's about a $50 round trip every time I want to go to Veracruz with the gasoline and the road and bridge tolls. So $50 each time, so $150 there. So there you have it. There's the cost of having my tori done, and yeah, very happy. I don't think I need to show you inside my mouth. It's everything's healing up very nice. There's some areas of my gums with lost sensitivity, but of course they were peeled away from the bone and the bone removed and then put back in. So things feel a little bit strange and a little patchy in the bottom of my mouth. Plus, you know, my tongue hasn't really been able to explore down there for many, many years. So it all feels a little strange, but it feels really good. The sutures are still dissolving. There's one wad that doesn't want to seem to go away. And I have pulled out some nail clippers and clipped off a few stray ones here and there, but I don't anticipate that being any problem. But thank you for watching, and if you want any additional information, feel free to reach out to me and be happy to give you Dr. Marisol's information. She was really nice, a real professional, and did a great job. So thanks for watching.